Welcome to my channel RX Sam 2020. Today we discuss a drug named Formoterol with budesonide inhaler or rotacaps. Medical use. Formoterol and budesonide. It is a fixed-dose combination medication used in the management of asthma or chronic obstructive pulmonary disease (COPD). It contains budesonide, a steroid, and formoterol, a long-acting beta-2 agonist, LABA. The product monograph does not support its use for sudden worsening or treatment of active bronchospasm. What is asthma? Asthma is a long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms. Symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath. These may occur a few times a day or a few times per week. Depending on the person, asthma symptoms may become worse at night or with exercise. Chronic obstructive pulmonary disease, COPD. It is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, sputum production, and wheezing. It's typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer, and a variety of other conditions. Contra-indications. Allergic to budesonide, formoterol, or the other ingredient of this medicine, which is lactose, which contains small amounts of milk protein. Special precautions. Diabetic. Lung infection. High blood pressure, or have you ever had a heart problem, including an uneven heartbeat, a high-speed pulse, narrowing of the arteries, or heart failure. Problems with thyroid or adrenal glands. Low levels of potassium in the blood. Severe liver problems. Contact the doctor if you experience blurred vision or other visual disturbances. Pregnant women. No clinical data on exposed pregnancies are available for the formoterol and budesonide combination or the concomitant treatment with formoterol and budesonide. Data from an embryofetal development study in the rat showed no evidence of any additional effect from the mixture. During pregnancy, formoterol and budesonide inhalers should only be used when the benefits outweigh the potential risks. The lowest effective dose of budesonide needed to maintain adequate asthma control should be used. Lactating women. Budesonide is excreted in breast milk. However, no effects on the suckling child are anticipated at therapeutic doses. It is not known whether formoterol passes into human breast milk. In rats, small amounts of formoterol have been detected in maternal milk. Administration of formoterol and budesonide inhalers to breastfeeding women should only be considered if the expected benefit to the mother is more significant than any possible risk to the child. Pediatrics. It is not recommended for children below 6 years as the safety and effectiveness were not established. Patients with renal impairment. There are no data available. Patients with hepatic impairment. There are no data available. Drug interactions. Interact with bronchodilators, albuterol. Steroids, prednisone. Water pills or diuretics, furosemide. Nonsteroidal anti-inflammatory drugs, aspirin. Antibiotic, azithromycin, antidepressant, duloxetine. Heart-related medicines or beta blockers, metoprolol. Antifungals, itraconazole, voriconazole, posaconazole, ketoconazole. HIV or AIDS drugs, ritonavir. Side effects. Fungal infection in the mouth. Headache. Sore throat, hoarse voice. Upper respiratory tract infection. Flu, cough. Back pain. Increased heart rate. Shaking or trembling. Brand names that are mostly prescribed by doctors. Vent FB. Formoterol NF. Symbiva. Symbicort. Dosage. Asthma. Adults, 18 years and above. The usual dose is 1 inhalation, twice a day. Increase this to 2 inhalations, twice a day, if necessary. Adolescents, 12 to 17 years. The usual dose is 1 inhalation, twice a day. Adjust the dose of this medicine to the lowest dose that controls asthma. Chronic obstructive pulmonary disease, COPD. Only to be used by adults. Aged 18 years and above. The usual dose is 1 inhalation twice a day. The doctor may also prescribe other bronchodilator drugs, for example, anticholinergics, such as tiotropium or ipratropium bromide, for COPD disease. Frequently asked questions. When do patients stop using this inhaler? Do not discontinue unless advised by your doctor. Rinse mouth with water after each use to prevent infections in the mouth and throat. Carry a rescue inhaler wherever you go. What is the main difference between COPD and asthma? People tend to develop asthma at a younger age due to a combination of genetics and environmental triggers. COPD is caused by long-term damage to the lungs, often from smoking. And asthma symptoms typically include a dry cough, whereas people with COPD are more likely to have a cough with mucus. What foods should be avoided while taking this medicine? Interact with grapefruit and grapefruit juice. Therefore, avoid intake of grapefruit or its juice with this medicine inhaler as it may lead to severe adverse effects. Mechanism of actions. Formoterol and budesonide inhalers have different modes of action and show additive effects in terms of reduction of asthma and chronic obstructive pulmonary disease, COPD, exacerbations. Budesonide. Budesonide is a glucocorticosteroid that when inhaled has a dose-dependent anti-inflammatory action in the airways, resulting in reduced symptoms and fewer asthma exacerbations. Inhaled budesonide has less severe adverse effects than systemic corticosteroids. The exact mechanism responsible for the anti-inflammatory effect of glucocorticosteroids is unknown. Formoterol. Formoterol is a selective beta-2 adrenoceptor agonist that when inhaled results in rapid and long-acting relaxation of bronchial smooth muscle in patients with reversible airway obstruction. The bronchodilating effect is dose-dependent, with an onset of effect within 1 to 3 minutes. The duration of effect is at least 12 hours after a single dose. Thank you for watching. Please like and subscribe to my channel and click the bell icon to get video updates.